GLP-1s as longevity medicine. Most people think of GLP-1 medications as weight loss drugs. And yes, weight loss can absolutely happen. But if you're on a GLP-1 or thinking about one, the number on the scale is probably not the most important thing happening in your body. In many cases, it may actually be the last thing to change. I'm Dr. Jeffrey Shukhman, and in this video, I want to explain why more physicians are starting to think about GLP-1s, not just as weight loss medications, but as something much bigger. Because when you really understand what these medications are doing, you stop seeing them as cosmetic tools and start seeing them as part of a much larger conversation about metabolic health, prevention, and longevity. The timing of this matters. Right now, GLP-1s are everywhere. Patients are hearing hype, fear, social media opinions, and a lot of noise. But what many people are not hearing is the deeper medical reframe. I practice prevention-focused concierge medicine here in the Calabasas area. And one of the most important things I help patients understand is this: the visible change is not always the most meaningful change. Just because the scale hasn't moved much yet does not mean the medication isn't working. In fact, some of the most important changes often begin well before dramatic weight loss shows up. So what's actually changing first? Usually, we start seeing improvements in the things that sit upstream of chronic disease. Inflammation begins to calm down, insulin sensitivity improves, blood sugar becomes more stable, blood pressure may actually start moving in the right direction, lipid markers improve, and overall cardiovascular risk begins to shift before a patient sees a dramatic visual transformation at all. That matters because those are not surface level changes, those are foundational changes. Those are the changes that affect how your body functions and how your body ages. This is why I say the scale is the last thing to change, not the most important thing changing. And that one idea can completely change how a patient experiences treatment. Because if the only thing you're watching is body weight, you may miss the entire story. You may think nothing important is happening. Meanwhile, your inflammation is improving, your insulin resistance is improving, your cardiovascular risk is improving, your metabolic health is improving. This is a very different framework than asking, is this helping me lose 10 pounds quickly? And honestly, it's a much more meaningful one. Here's the bigger picture. A lot of what shortens modern lifespan comes from the same root problems. It's insulin resistance, chronic inflammation, visceral fat, blood sugar changes, and dysregulation. These are not separate issues. They're all connected. They sit underneath many of the conditions people eventually develop. So when a medication starts improving those root drivers early, that's not just weight loss medicine. That's longevity medicine. That's prevention medicine. That's risk reduction medicine. And that's why physicians are starting to really describe GLP-1s as first-in-class longevity drugs. Not because they make someone thinner, but because they improve the metabolic environment. That determines long-term health. This does not mean GLP-1s are magic, and it does not mean they're right for everyone. It also doesn't mean we should use them casually or without proper medical oversight. But it does mean we should stop using an outdated standard to judge whether they're working or not. If the conversation begins and ends with body weight, we're asking the wrong question. The better question is, what is this medication doing to the systems that actually determine long-term health? So what does real monitoring look like? It's not just the scale. We look at inflammation markers like hsCRP. We look at fasting insulin and HOMA-IR. We look at ApoB and lipid markers. We track hemoglobin A1Cs. We monitor blood pressure, your resting heart rate, and ideally, we're also looking at body composition because losing fat is not the same as just losing weight on the scale. And preserving muscle matters a lot. We also pay attention to how patients feel, energy, sleep, mood, appetite control. Sometimes those are the first signs that things are improving. So if your physician is only weighing you, you may be missing the whole point. Now, who should actually consider a GLP-1 medication? Not everyone, but it may make sense for a lot of people with insulin resistance, prediabetes, elevated visceral fat, persistent inflammation, family history of metabolic disease, or weight that is resistant to thoughtful lifestyle changes. Also menopause-related metabolic shifts. That's another important group. But this is key. A GLP-1 is not the right first step for everyone. This should be a physician conversation, not a marketing decision. The right approach depends on your labs, your history, your goal, and your overall plan. If you're already on a GLP-1, think beyond the scale. Ask what else is being measured. Ask what's improving internally. And if you're considering one, don't just ask, will this help me lose weight? Ask, is this the right tool for my long-term health? If you want a plan to boost your metabolism, I put together a free guide that walks you through the exact steps. You can download that below. And if you want to talk through your personal situation directly, you can book a consultation as well. We're based in Woodland Hills and work with patients throughout Calabasas, Hidden Hills, and the surrounding areas. And I'll leave you with this. The right question is not how fast the weight is coming off. It's what the medication is doing for your long-term health and how we measure that.